Thank you again for joining us on our short discussion for today. I can see familiar names here in our live streaming, and I can also see here the names of my previous colleagues there in the Middle East. Ayan, so good morning there in the Middle East. There are people here who are from Kingdom of Saudi Arabia. Good morning. And for everybody, thank you for joining us and for trusting again once IPASS. So for today, we're going to have a very short discussion with the test-taking strategies, the most important concepts, and the most important age that you need to remember when we will be dealing with cancer screening. So in NCLEX, dear nurses, when you will be given questions on cancer, it could be about carcinogenesis, risk factors of cancer, when you should screen for cancer, and what are the most common symptoms of each cancer and the most common treatment regimen. So in the actual review, we will be tackling about the carcinogenesis, risk factors, cancer screening, the radiation therapy, the chemotherapy. I'm going to discuss there. How will you going to understand easily your chemotherapeutic drugs? And we will also handle there or discuss there the different types of cancer. But for today, I'm going to teach you the most important test-taking strategies and cancer screening based on the US. All right. So this is with regards to US, Canada, and Australia, because it's different here in the Philippines. It's different in the Middle East. All right. And when I came back here in the Philippines after I worked in a government hospital and there were lots of cases, COVID cases, I chose to stop on working in a hospital, and I worked as an online or as a virtual nurse, all right, in Illinois. Specifically, it's a large independent hospital there in Illinois. And I was about to, I had the chance to understand more about cancer screening because it's totally different, all right, in the US, in Canada, and in Australia. So I'm going to give to you now the different strategies that we need to know for your NCLEX. All right, so let's move on. All right, so we have cancer screening, and very important part of your cancer screening is, of course, you should know what are the most common symptoms of cancer, because without knowing the symptoms of cancer, without knowing proper assessment, you will not have an idea that it is a manifestation of cancer. And always remember, dear nurses, early screening is very important for early detection and prompt treatment. Take it from my side, because my father died last year, November 10 of last year, because of urinary bladder cancer. It metastasized to the prostate, to the bones, all right, for 2.5 years. And finally, he rests peacefully because it metastasized to his lungs. So I appreciated all of this manifestation. I saw the manifestation that he had, and I appreciated the treatment regimen and the needed screening for cancer. All right, so let's start. Okay, so first we have cancer screening, and we have the infamous CAUTION acronym. All right, we have CAUTION, CAUTION. In others, we have the CAUTIONAL with the AL at the end. So when you memorize, when you understand this acronym and the manifestations that are related to this acronym, you will have an idea what is the pathognomonic sign of each cancer. All right, so let me just write here. Letter C. Let's start po. Let's start with letter C. What is letter C? I know you know what does letter C stands for. It's letter C, change. Sana. All right, change in bladder or bowel habits. Alright, bago tayo pupunta dun sa actual screening itself, kailan ba mag-TSE, kailan ba mag-BSE, kailan ba mag-colonoscopy, we need first to know the manifestations. Alright, change in bladder or bowel habits. From these terms itself, we have the bladder, urinary bladder, okay? Not the gallbladder. Iba po ang gallbladder. Gallbladder is related to the gastrointestinal disorder. But here we are talking about the urinary bladder or the pantog or the one that contains the urine after it is produced by your kidneys before it can be expelled to the external environment. So urinary bladder muna tayo. In your urinary bladder, the most common or the pathognomonic sign for cancer is none other than painless hematuria. Again. So pag urinary bladder daw, dear nurses, ang pathognomonic sign natin ay painless hematuria, meaning the client with urinary bladder cancer will urinate without pain, without experiencing any tenderness, with blood. All right, there is gross hematuria. Again, there is painless hematuria. There is gross hematuria. Question, dear nurses, if the client is peeing blood, will there be a possibility of clot formation because the area has blood? Yes. Aside from having clot formation, will also there be a possibility of having anemia? Yes, because the client is losing blood. So, in line with bladder cancer, in line with your painless hematuria, you can also see a client with urinary bladder cancer with what? Possible clot formation and possible anemia. Let's go back to the clot. Pag si client, meron siyang clot formation sa urinary bladder niya. Yung clot ba yon could be dislodged to the urethra? Yes, when the clot dislodges the urethra, causing obstruction, can it lead to urinary retention? Yes. So, again, blood coagulation or clot formation causing obstruction, causing urinary retention. All right. If the client develops urinary retention, then there will be what? What will be the manifestation? There will be enlargement of the lower abdominal area. All right, there will now be tenderness. There could be what? Ascending or backflow of the urine to your what? Ureters, causing now possible damage to the kidneys. Ulitin ko, dear nurses, doon pa lang tayo sa una. Change in bladder habits, which is what? Painless hematuria, since may blood, may possible clotting, may possible obstruction, may possible retention. Yung ihing natira, what will happen? It stays in your urinary bladder, which can backflow to your ureters, going to your kidneys, causing what? Kidney damage. Alright? Ang term doon sa backflow is known as your hydronephrosis. Alright? Hydronephrosis. Alright? The backflow of the urine. So, painless hematuria for your urinary bladder cancer. Okay? Na-appreciate ko yan to my father. Talagang umiihi siya ng dugo and it is something that is an emergency because it's a pathognomonic sign. Next one, change in what? Bowel habits. All right, change in bowel habits. Since we are talking here about your bowel, we are talking here about your large intestines, which will what? Expel your feces to your external environment. Just an idea, dear nurses, ano bang difference ng feces sa stool? Ayan, I taught this concept to my fundamentals of nursing students here in IPASS. Anong difference daw ng feces sa stool? Feces or fecal matter is the waste product of digestion present in your colon. Nasa loob pa siya ng large intestines mo. But once you expelled it, naitain mo na, you were able to defecate it to the external environment, it is now called a stool. Alright? So, feces versus stool. Feces nasa loob. Stool, nilabas mo na. Alright, balik tayo. Change in bowel habits. Alright, a client with colon cancer. All right, a client with colon cancer, what is the pathognomonic sign? Alternating constipation and diarrhea plus microscopic blood. Again, all right, for clients with colon cancer, there is what? Alternating what? Constipation and diarrhea, plus there's a plus sign there, microscopic blood. Ibig sabihin, this can only be found if the client will undergo fecal occult blood test or your guaiac test and your FIT. All right, this is another test which is common in the US. Kung ayaw ni doctor na pagawa ang fecal occult blood test, papagawa niya yung si FIT or the DNA testing of your stool. All right, again, change in bladder habits, urinary bladder cancer, painless hematuria, obstruction, retention, backflow. Again, colon cancer, change in bowel habits. Nag-alternate, minsan constipated si client. The client sometimes have diarrhea, and both of this alternating constipation and diarrhea does not have any relation to the food intake, does not have any relation to the movement of the client, does not have any relation to the water intake. Basta nag-alternate, hindi dahil sa diet. Plus, there's a plus, microscopic blood, which can also only be seen with what? Your FOBT or your FIT. Anong difference ng dalawa? FOBT is just under the microscope to check kung merong blood, microscopic blood. All right? In FIT, it will undergo DNA testing ng ihi mo. Ma'am, bakit po? Ano bang makikita sa DNA testing? Makikita kung may gene problem. Kung meron ng genetic problem leading to what? Colon cancer. All right? I will tell you later what are the risk natin with colon cancer based on our cancer screening colon. Okay? So letter A. Let's move on to letter A. Letter A is what? A sore that does heal or does not heal. All right, does not heal. A sore that does not heal. Why? Why in cancer, if the client has a sore, if a client has an injury, it does not heal or there is delayed healing? Always remember, cancer cells, all right, cancer cells, they get the nutrients, they get the oxygen, they get the protein, all right, they get all the necessary substances that is needed for what? For wound healing. All right, cancer cells, it gets the oxygen, it also gets the what? Nutrients. Kaya pala, ang mga cancer patients po ba nagkakaroon ng anemia? Yes. All right, cancer gets the oxygen leading to anemia. Cancer gets the nutrients leading to problem in your protein. Protein is needed for what? Tissue repair. All right, wala ka ng oxygen sa site, wala ka pang protein sa site, problem now, delayed in healing, or worse, a sore that does not heal. All right, that is for letter A. Let's move on to letter U. What is that letter U? Unusual. All right, hindi common daw. Unusual bleeding or discharge. Unusual bleeding or discharge. Question. Normal po ba? Is it normal that after the very first sexual intercourse, there will be bleeding sa female client or sa partner? Yes, that is normal because of the tear of the hymen. This is expected if it's your first time to have sexual intercourse, tear of the hymen. However, if the client has unusual bleeding, specifically, let me put it on a red mark here, specifically, all right, specifically, a client will manifest post-coital bleeding, all right? Post-coital bleeding, meaning after every sexual intercourse, the client will bleed. All right, after every sexual intercourse, the client will bleed, meaning there is what? Occurring injury to the cervical area, and postcoital bleeding is the pathognomonic sign of your cervical CA. Alright, so cervical cancer, nakailang cancer na tayo? Pangatlo na to ha. Urinary bladder cancer sa letter C, colon cancer sa letter C. Unusual bleeding is your post-coital bleeding every after sexual intercourse. The client will bleed. It's a sign of your what? Cervical cancer. Alright, example, ma'am, the client had her very first sexual intercourse and then the client bled. Is it normal? It is normal. All right. Example again, ma'am, the client is fertile. When we say fertile, mataas ang temperature ni client on that day. The mucus secretion of the client is thin, it is watery, you could stretch it. All right. So the client is fertile, nakipag-sexual intercourse siya nung fertile day nga, and then suddenly may minimal bleeding after that. It is also normal. Why? Because during ovulation, when the ovaries nilabas na niya si egg cell, magkakaroon talaga ng minimal trauma. Kasi after malabas ni ovaries si egg cell, it will go to your fallopian tube. Pagdating doon ni egg cell, may minimal trauma to that area. Alright? So kapag nangyari yon, it is expected that may minimal bleeding talaga on that day. So that's okay. After very first sexual intercourse, when you had sex during your fertile period, ayan, pwede magkaroon ng minimal bleeding. However, if the client is having sex and every time the sex is done, there is bleeding, that is considered abnormal because trauma to your cervix, in cervical cancer, kumakapal ang cervix. All right, postcoital bleeding, cervical cancer. Is it unusual? It is unusual. All right, another unusual bleeding, their nurses, is postmenopausal. All right, postmenopausal bleeding. Ibig sabihin, the client is already menopaused. All right, how will you know that you are already menopaused? You don't have menses for 1 year. All right, for 12 consecutive months. Wala ka ng menstruation sa loob ng 1 taon. And then suddenly, you bled. You had menstruation. All right? That is postmenopausal bleeding and it is a sign of your uterine cancer. All right? It is a sign of your uterine cancer. So these patients who have postmenopausal bleeding, papacheck yan. They will undergo dilatation and curettage. All right, they will undergo dilatation and curettage. And when you check the output, yung mascrape in the uterine cavity, the appearance of this one looks like brain. All right, pag chinek mo yung dugo na makikita kapag na-scrape na si client, mukha siyang brain. Alam niyo yung laman ng bone marrow. Ayan, masarap ba yon? Yung sa bulalo, no? Yung laman ng bone marrow na yon, the browny part na slimy, that is the same appearance and consistency of the tissues that are being taken after the curettage of a client with possible uterine cancer. Right? Brainy appearance siya. Okay? So, unusual bleeding, hindi dapat magdugo, pero nagdugo. Ano daw yon? Postcoital bleeding for cervical cancer and postmenopausal bleeding for uterine cancer. Okay? And another one is unusual bleeding or discharge. So sabi dyan, unusual discharge. And what is that unusual discharge? This could be seen on clients with what? Breast cancer. Alright? So for unusual bleeding, uterine cancer, and cervical cancer, for unusual discharge, this is what? For breast cancer. When a client performs breast self-exam, that I'm going to teach you later, when a client performs breast self-exam, the last step of breast self-examination is to pinch the nipple. And when the client pinches her nipple, there is what? Discharge will be released. It's a pus, all right? Pus, may nana inside the breast. All right, this is a manifestation of your what? Breast cancer. All right, now let's go to letter T. What is that letter T? Thickening. All right, thickening lump in the breast or elsewhere. All right, thickening lump in the breast or elsewhere. In the first place, lump formation, ayan, this is the start of cancer. Yung pagbuo ng lump, yung pagbuo ng tumor, ng cyst na yan ang start ng cancer. Bakit po? Bakit nagkakaroon ng lump formation? Remember, in cancer, there is no G0 phase. Alright? Walang phase ng resting ang cancer cell. So, kung walang phase ng resting ang cancer cell, dear nurses, example, ito yung cell mo, no? Since there is no resting phase, do you expect that mitosis or cell production is continuous? Yes, so tuloy-tuloy ang mitosis. And these multiple cells that have been produced can form now a lump. Kaya pala, kapag may cancer, expect there is lump, there is tumor, there is cyst formation because of multiple cell production because of the absence of the resting phase. And these type of cells, they are abnormal in appearance. They don't look like their neighbor cells. Meron tayong tinatawag na dysplasia, all right? Iba yung display niya, iba yung appearance niya, iba yung characteristics niya. That is why the term is called dysplasia, all right? Dysplasia, tumor formation there. That is why manifestation of cancer in your cancer screening is thickening lump in the breast. Ma'am, bakit po breast? Just an example here in the acronym, okay? Thickening lump in the breast or elsewhere kasi all cancer starts with a what? A lump formation, okay? Next one ay indigestion or end na lang tayo. Dysphagia. Alright, indigestion and dysphagia. Anong cancer naman ang dalawang ito? Alright, si letter C is bladder and colon. Si letter U is uterine and breast and cervical. Si letter T is for almost all types of cancer because of the lump. And letter I, indigestion, is for gastric cancer. Alright, it is for gastric cancer. And dysphagia naman is for what? Pharyngeal or your throat cancer. Pharyngeal or your throat cancer. Punta muna tayo kay indigestion. Alright. In your indigestion, dear nurses, we all know that our gastric part, right, let me draw here. Alright, if this is our stomach, if you can join us in the review, alright, kapag i-handle ko ang gastrointestinal system, I'm going to teach you yung paano yung mechanism kung kailan nadadigest si protein. Example, kumain ka ng bread, no? Si bread ko, na-digest na siya ni salivary amylase ko, na-digest na siya ni pancreatic amylase ko. Yung steps in digestion natin. So with that, all right, I will just give you a brief overview. Pag napunta na kasi si food, ayan, si bolus sa ating stomach, may mamimit siya na dalawang cells. Alright, may mamimit daw siya na dalawang cells. Ano daw yung dalawang cells na yon? Letter P, si parietal cells. At si next cells is letter C, si chief cells. Alright, so our food goes now to our stomach. Na-mix na siya ng saliva, ng salivary amylase mo. Bumaba na siya sa stomach mo. Na-meet na niya si parietal cells. Na-meet na niya si chief cells. Alright, si parietal cells, it produces your hydrochloric acid. Alright, parietal cells, it produces your hydrochloric acid. And hydrochloric acid aids in what? What? Digestion. Pero hindi pa final. Bababa pa yan sa small intestines. Marami pa siyang mamimit doon ng mga enzymes. And parietal cells secretes hydrochloric acid which will digest partially again our food. And also our food will meet chief cells which will produces pepsinogen. Alright. Chief cells produces pepsinogen. So si pepsinogen, pag naghalo siya kay acid, mako-convert siya to pepsin. Alright? It will be converted to pepsin, which will digest letter P as well, protein. Alright? Ulitin ko. Chief cells produces pepsinogen. Pepsinogen, when combined to your acid, gastric acid, it will now be called pepsin. When pepsin meets up with protein, ida-digest nga si protein. Pero hindi pa tapos, meron pa sa small intestines, ha? So, na-meet na niya ngayon si protein. Madadigest na si protein. Sirain natin si gastric area. The client has gastric cancer. Ma'am, bakit po nagka-gastric cancer siya? Possible kasi the client could have previous Helicobacter pylori infection. Ayan, yung nagkakos din pala ng peptic ulcer, yun din pala ang pwedeng mag-cause ng gastric cancer. Yes, they are called your oncogenic viruses. They are called your oncogenic viruses. These are the viruses that causes cancer, such as your Helicobacter pylori, such as your HPV. Ayan, sa cervical CA naman natin. Alright, so balik tayo. If the client, meron daw siyang previous Helicobacter pylori infection, causing ulcer, causing damage to your cells, causing damage to the lining. Kasi ang mga cells mo, nandyan yan sa lining ng stomach mo. Dahil nagka-ulcer, na-damage yung lining, namatay yung cells. If the cells are dead, if the cells are insufficient or decreased in number, therefore, the hydrochloric acid is decreased, the pepsinogen, the pepsin are decreased. Problem now is what? Indigestion. So that is the mechanism. What is the principle again of Ma'am Haya? Like what I've said in our previous live streaming, my principle is know first the normal. So that any deviation from the normal, you will understand the abnormal. Maintindihan mo ang reason for the manifestation so that you can give the most important nursing intervention. So again, let's have a recap. If the client has parietal cells, which produces hydrochloric acid. The client has chief cells, which produces pepsinogen. Combined with the acid is now pepsin, which will digest protein. Everything is okay. However, the client had a previous infection, your H. pylori, damaging the wall, damaging the cells, decreasing the acid, decreasing the pepsin, causing what? Manifestation of gastric CA? Indigestion, all right? Because of the absence of these enzymes. Okay, kaya pala na-derive ang indigestion. Okay? Next, the client has throat cancer. The client has dysphagia. The client has pharyngeal cancer. Sabi ko kanina, if there is cancer, dear nurses, there is lump formation. Kakapal po ba yung throat niya? Yes. If the throat is enlarged, if the throat is tender, if the throat is inflamed, of course, you will experience dysphagia or what? Difficulty in swallowing. Ma'am, hindi po ba yan painful? Hindi pa yan yung term natin na painful, alright? Dysphagia is D as well. Dysphagia, difficulty. Dysphagia, difficulty. Dysphagia is difficulty of swallowing. Ma'am, ano po yung painful swallowing? That is what? Odinophagia, all right? Odinophagia or your odinophagia. That is your painful swallowing. Okay, nakailan na tayo? Dami na nating cancer. 1, 2, 3, 4, 5. Ayan, 6, 7. How about letter O? Letter O signifies or stands for obvious change in wart or mole. Ayan, obvious change in wart or mole. Okay. So, normal po bang meron tayong mga moles? Ayan. And have you experienced or noticed that sometimes you don't have the mole in this body part and then suddenly meron ka ng mole on that part? Yes, that is okay. Totally okay lang yan. Why? Remember, our skin has melanin. So, meron siyang melanin. Ayan, nakaspread yan sa skin mo. However, if your melanin is confined in one specific area, dyan na-form yung mole. Pag na-confine daw siya sa isang specific area, ano daw yun? Dyan nagkakaroon ng mole. Kaya pala, better to have lesser moles. Alright? Mas maganda na konti lang ang nunal. Kasi the more na marami kang nunal, the more na nako-confine lang yung melanin mo in one area instead na nakaspread siya. And melanin is our protection. It is used for protecting the skin. So the more na marami kang melanin, the more na brownish ang color mo, the more you are protected from the UV rays of the sun. Alright? Pero if the client is fair complexion, Caucasians, no, masyado silang mapuputi, and their moles are confined in specific area instead of being spread sa skin, sila ang increased risk for what? Skin cancer. Alright, better nga na konti ang mole mo, ibig sabihin ang melanin mo nakaspread yan to protect you. Alright, so obvious change in wart and mole. How will you know that your mole or your wart is changing? We have the ABCD of your skin cancer. Let me just erase this diagram here. All right, so we have the ABCD of skin cancer. Letter A is asymmetry. All right, asymmetry, meaning you will compare one side to the other side. Kung ito yung mole mo, all right, kung ito yung mole mo, this is one side and the other side is ganyan yung itsura. Alright? So there is asymmetry. Alright? Aside from letter B, borders are irregular, may asymmetry sa side. Alright? Okay yung ganito. Alright? If you will divide it into two, this is symmetrical to the other side. However, in your skin cancer, if you will divide it into two, thus the left portion is asymmetrical from the right portion. So there is asymmetry. That's letter A of your skin cancer. Let's go to letter B. And borders are regular or irregular? Borders are irregular. Ibig sabihin, it's not a perfect circle. It's not, the edges are not smooth. Irregular nga yung shape niya. Alright? So, ganito. Ganito rin in our picture here. Alright? Sana aking. Alright? Ganito rin yung itsura niya. There is irregularity in the shape, asymmetry in the shape. Alright? Next, letter C of the ABCDE of skin cancer. Letter C is what? Colors are unusual. Alright? The colors are unusual. Dapat po ba brownish, blackish ang ating mga moles? Yes. However, for a client with skin cancer, their moles have different color. It's reddish, it's bluish, it's purplish in color. Alright? Red, blue, purple. Ganyan ang color ng skin cancer. Alright, for those who have normal moles, symmetrical, regular, brownish, blackish. Okay lang yan. Next, diameter. A, B, C, D, E. Diameter of skin cancer is more than 6 millimeter. Alright, more than 6 millimeter po daw, yan ay cancerous. More than 6 millimeter is cancerous. Ma'am, how will I know if it's millimeter? Paano ko ba susukatin? You know the pointy part of a pencil, that is 1 millimeter. Yung pencil po na tinasa, ha, dear nurses, tasahin mo yung pencil mo, hindi yung pencil na pudpod. Yung pencil na tinasa, alright? A sharp pencil. Ano mo yan, i-draw mo yan, i-point mo yan sa isang bond paper. That is 1 millimeter. Alright? How will you know that it is 5 millimeter? Alright? Ay, ano muna tayo? Crayon. Ang crayon, yung point nga, yung dulo ng crayon, that is 2 millimeters. Pencil is 1 millimeter. Crayon is 2 millimeter. At yung eraser ng pencil. Pencil number 2, ha? Maraming types ng pencil. May pencil number 5, yung mga jumbo pencil natin nung ano tayo, no? Nung kinder tayo, dear nurses. So yung pencil number 2, yung eraser daw niya, di ba red yun? Kinakagat-kagat mo ba yun nung bata ka? Naubos ba yun dahil sa kakakagat mo? Oo, no? Alright, so yung end daw ng pencil, yung eraser niya, that is 5 millimeters. Alright? So kapag papa-explain natin kay client or if you want to describe it to the client, or if you want to assess the client's mole, pag more than daw sa size ng eraser ng pencil na yon, it is considered 6 millimeters and up, and that could be possibly malignant. All right, that could be possibly cancerous type of skin cancer. Ulitin ko, when it comes to diameter, it's more than 6 millimeters. So ang dulo daw of a sharpened pencil is 1 millimeter. Of a crayon, yung crayon po na matino ha, yung hindi yung crayon na pinutol mo na. Ayan, naalala ko yung mga anak ko, potol-potol na lahat ng crayons nila. So if an end of a crayon is 2 millimeter, the end of a pencil, the eraser of a pencil is 5 millimeter in diameter. So kung pag lumaki siya to the pencil eraser, that is a cancerous, could probably a cancerous type of skin cancer, right? And letter E, finally, evolving, all right? A skin cancer is, or the mole, your mole na possibly cancerous, it is evolving. Ibig sabihin, it doesn't stay in that shape, it doesn't stay in that size, it doesn't stay in that color. It's constantly evolving because of the constant mitosis. Okay, so that is the ABCDE of skin cancer. Asymmetry, borders are irregular, colors are unusual, diameter is more than 6 millimeter, and it's evolving because of the constant mitosis. And finally, letter N is what? Nagging cough or hoarseness. Hoarseness of voice. All right. Nagging cough or hoarseness of voice. So, nagging cough is a manifestation of your what? Lung cancer. All right. How will you know that it's a nagging cough? Nanag ka na ba ng asawa mo? Lalaki, joke lang, asang babae, no? Babae po bang laging nagnanag? Ayan, usually babae, no? All right. When a person nags at you, is it a paroxysms of discussions, ayan, paroxysms of word, no? So in a nagging cough or a client with lung cancer, meron din siyang nagging cough, paroxysms of cough, and it is dry. So dry cough without sputum, derecho. All right, paroxysms of dry cough is your nagging cough. If it's paroxysms of dry cough with a whoop at the end, whooping cough yon, pertussis yon, all right? Pero if it's just nagging cough, paroxysms of dry cough, that is lung cancer. All right? How will you know na meron din siyang lung cancer? Kakaiba rin yung color ng sputum niya. Anong color yon? It's purple. All right? The color of the sputum of a client with lung cancer, it is what? Purple sputum. Yung plema niya, color purple. Kakaiba, no? All right? Kasi we have different types of sputum. May pula, may rusty, may gray, may yellowish, may greenish, may purple, may pinkish. All right? I taught that in the fundamentals of nursing. So, pag purple na ang lumabas, may nagging cough pa siya, lung cancer. Okay? Finally, hoarseness of voice. Hoarseness of voice is a manifestation of your what? Laryngeal cancer. Laryngeal cancer. Ma'am, bakit po? Remember, overuse of a body part. Lahat ng na-overuse, mabilis mag-divide ang cells. Alright? Lahat ng no-overuse, nagkakaroon ng hypertrophy, di ba? Pag ikaw, if you are going to the gym, you're doing your weightlifting, nagkakaroon po ba ng hypertrophy, enlargement ng body part na yon? Example, your biceps, your triceps, yes, because of the overuse. Right? Same principle in your larynx. If your larynx is constantly overuse, alright, nagkakaroon na ng tenderness, inflammation, friction, all right? Samahan mo pa ng smoking. So this could now lead to what? Laryngeal cancer. Again, overuse of the larynx. Samahan mo pa ng cigarette smoking, which contains lots of carcinogens. Ayan, it can lead to what? Laryngeal cancer. Sino po ba yung mga at risk for laryngeal cancer? Are these the singers? Ayan, constantly kumakanta. Yes, possible, no? Singers, teachers, educators, like Ma'am Haya, kung everyday ang klasiko. I still remember back in 2010, I taught nursing students both in undergraduate school as well yung mga graduates na in preparing for their board examination back in 2010 up to 2016. Ayan, I graduated in 2009, nag-start akong magturo 2010. So halos kaedad ko lang din yung tinuturuan ko. Nakaka-pressure ba yon? Sobrang nakaka-pressure. So during those days, every day ang lecture, 300 students, 200 students in one class, napakaraming nurses, ang saya-saya, nursing student ako. Pagka-graduate ko, wala nang trabaho. Ganun ba yung nangyari? Yes, ganun nga. So I experienced the days where I cannot totally talk because of the overuse of my larynx, and I am putting lidocaine spray para lang mawala yung pain. All right, so this overusage of your body parts can lead to different types of cancer. So this is basically our caution acronym as per the American Cancer Society for the different types and the most common types of cancer for male and female. What is letter C again? Change in bladder habits for your bladder cancer, painless hematuria. Change in bowel habits for your what? Colon cancer. All right. And a sore that does not heal for letter A, a sore that does not heal. This is based on what? Kinuha ni cancer ang oxygen at nutrients, causing delayed and even worse, no healing of any sore, all right, or any injury. Next, unusual bleeding. Unusual bleeding ba na after sexual intercourse nag-bleed? Hindi naman niya first time. Yes, so that is cervical cancer, postcoital bleeding. Unusual bleeding ba na after menopause nag-bleed ulit? Yes, so that is uterine cancer as discussed a while ago. Thickening lump. Bakit may lump? Kasi laging may mitosis. Indigestion. Kasi wala na or sira na si parietal cells at si chief cells, decreasing the acid, causing indigestion. Alright, obvious change in wart and mole. Meron ka bang ABCD? Yes. Asymmetry. Borders are irregular. Colors are unusual. Ano pa? Letter D, diameter is more than 6 millimeters and evolving, constantly evolving kasi nga may mitosis, kasi nga may dysplasia. And letter N, nagging cough for lung cancer and hoarseness of voice for what? Laryngeal cancer. So we are done with our cancer screening. Hindi pa tapos yung topic. I'm going to teach to you, nasaan na? All right. Our cancer screening ladder. Is this a ladder? Yes. It is a ladder. And it contains different ages kung kailan ka mag-start ng screening mo. And this is based on American Cancer Society. Ito yung and our CDC. Alright? Center for Disease Control. Ang basis natin dito and American Cancer Society. So by age tayo. Alright? By age. Anong age natin? First age ng cancer screening mo. Sorry. Na. Right. First age ng cancer screening mo ay 15. At sa lalaki muna tayo, 50. Dalawang age ang tatandaan mo sa lalaki muna. 15 at 50. 15 at 50. Pag 15, start mo na si Allen. Testicular self-exam. Alright. Sino pa po ba ang 15 years old dito? Wala na sa atin. Baka anak na po ninyo. Alright. Or kapatid na. Tell your teenage boy, all right? Tell your younger brother at 15 years old, start mo na ang TSE mo. Every month ba? Every month, all right? Every month, all right? Choose a date. All right, choose a date. Example, I'm going to do my TSE every 5th day of the month. All right, so November 5, December 5, January 5, February 5. Basta same date every month. After a warm or a cold bath, it should be a warm bath. All right, warm bath. We all know the reason, because when the client undergone a warm bath, what will happen to the testis and to the scrotum? It is relaxed and it is descended. Nakababa siya, nakarelax siya for proper assessment. All right, 15 years old. Excuse me, start your testicular self-examination every month on a same date. All right, same date after a warm bath for it to be relaxed and descended. All right, for proper proper assessment. So paano po ba nag-a-assess? All right, check mo daw dyan ang possibility of testicular cancer, which contains the 4 L's of your testicular CA. All right, ano yung 4 L's natin? Check for a lump, check if it's loaded, check if it's large, and check if it's leathery. All right, the 4 L's of your testicular cancer. Is there a lump? Is it loaded? Is it large? Is it leathery? Paano ko ba i-explain? Wala tayong mag-demo dito, guys, no? Wala akong sample na magde-demo dito na merong testis na aking i-assess, all right? So, paano daw i-assess? Dapat kasi this is relaxed. Why? First, you need to pinch the skin upward, no? Pinch. If this is the scrotum of the client, yung skin niya, ipipinch mo upward, all right? Pinch it upward and start for palpating for a lump. Start for palpating for a lump. Pag may nakapaka, let me draw here. Alright. Pag may nakapaka, right? Example, nagkakapaka. Ito ang kanyang right testis. Alright. Ito ang kanyang left testis. The right and the left. Ma'am, bakit ganyan yung drawing? Ganyan talaga. Mas mababa ang left testis as compared to the right. Alright? The left testis is slightly lower than the right testis. Slightly lang. Okay? Alright. So, nagpalpate siya. Tinaas niya si skin of the scrotum and then palpate niya pababa. Ganito yung hawak ha. Non-dominant hand, taas. Dominant hand, pababa. Hindi light palpation only. Wag heavy, no? Wag deep palpation, wag namang may pressure kasi tender yan. So, pababa niyang ipapalpate yung area. If the client palpated a lump here on the upper portion, do not report. Ayan, do not report. Bakit? Epididymis yan. Wag mong i-report. Okay? Epididymis. But if the client palpated a lump in the other parts of the testis, except on the upper portion, which is your epididymis, if napalpate niya dito, o kaya on the other part, except nga sa taas, you should report it. Alright, to report it. Kasi, these are possible, cancer formation. Ayan, so ang mga lump daw na pwede mong ma-assess dyan could be like a size of a rice or not a rice, no? Wag yung luto, no? Yung grain pa lang pala. Ayan, matigas. Alright, a size of a grain of rice. Ayan, yun yung mga pwedeng yang mapalpate. Wag lang yung sa taas, epididymis iyon. Alright, so check for a lump. Letter L, check if it's large. Ibig sabihin, when you check for the symmetry, the other one is large as compared to the right. Again, but kasi may enlargement, kasi may mitosis, kasi may dysplasia. Alright, there is continuous production kasi nga walang resting phase. Alright, so check if there's a lump, check if it's large, check if it's loaded. How will you know if it's loaded? Mabigat siya. Paano malalaman na mabigat siya? Mas low siya. Alright? Mas mababa siya as compared to the other testis. Kasi dapat slightly lower lang. Like in my image here. Alright? Gaya nung drawing ko dito, si left is slightly lower than the right. Okay? Lump, tapos malaki pa siya, kaya siya mabigat kasi malaki siya. And check if it's leathery. All right. When you say it's leathery, it is what? Shiny. Yung scrotum ni client, instead of being wrinkled, nagiging shiny appearance din si scrotum. All right. Because a leather shoes, a leather bag, ano yan? Smooth and shiny sila. All right. So the appearance of the scrotum is what? Leathery. Right, those are the 4 L's. When you should start it, 15. Punta tayo sa 50. Lalaki muna tayo bago tayo sa babae. All right. At 50 years old, colonoscopy, FOBT, or your FIT. All right. For colon cancer, you can also start. Hold on. Let me just change the para hindi malito. You can also start digital rectal exam and PSA at this age then for prostate cancer. All right, punta muna tayo kay color blue. At 50 years old, start your colonoscopy and your fecal occult blood test or your FIT with DNA testing. Ayan, this will detect what? Microscopic blood. Ma'am, para saan po yan again? For colon cancer. And it depends on your risk. All right. According to American Cancer Society, meron tayong 4 na level ng risk ni colon cancer. How many daw? 4. Ano lang daw? 4. All right. Ano yung 4 na yon? First is the average risk. Average risk. I'll change it to blue para di malito. We're still talking on the blue part. And what is that blue part? We are still on colon cancer. Average risk. All right. Increased risk. High risk. And highest risk. Highest risk. All right. Average risk, increased risk, and high risk and highest risk. Depende kasi sa history mo. All right. Example. We are talking here about the average risk. Sa average risk, wala siyang history ng colon cancer, wala siyang family history of colon cancer, wala siyang adenoma, wala siyang polyps, wala siyang manifestation, pero considered pa rin siyang average risk. In short, lahat ng male clients who are 50 years old starts from what risk? Average risk. All right. So if you are 50 years old with no history of colon CA or other types of CA, no family history, no polyps, no adenomas, no manifestations of alternating constipation and diarrhea, wala ka ng lahat ng yan, ang tawag sa'yo, average risk, you are encouraged, you are advised to undergo colonoscopy, FOBT, or fecal occult blood test, and FIT at the age of what? 50 years old. All right, at the age of 50 years old. Pag, ma'am, how will I know na I am increased risk? How will I know? If you have a family history. All right, positive family history ka ng colon cancer. Maliliit ba natin to? Hindi siya pwede maliit. Alright, family history ka of colon cancer. You are on the increased risk and you should start your colonoscopy at the age of 40. Alright, start colonoscopy. Baba ko, dear nurses, ha? Start colonoscopy at the age of what? 40. Anong risk mo daw? Increased risk. Bakit ka under increased risk? Kasi may family history ka. Okay? Next. High risk, kung meron kang irritable bowel disease, meron kang ulcerative colitis, meron kang Crohn's disease, ikaw ay under high risk. Alright? You are under high risk and you should start colonoscopy at the age of 20. Alright? Start colonoscopy at the age of 20. And highest risk, you have confirmed genetic testing. All right. You have confirmed genetic testing. Ibig sabihin, you even before, meron ka ng defect sa chromosomes na detect na sa DNA mo, may genetic testing ka ng confirmed that you have the chance to have your colon CA, you are on the highest risk, start mo rin at the age of 20. All right, 20. Again, let's have a recap. Pag 50 years old, this is the age advised for male clients to undergo colonoscopy, FOBT, or FIT at 50 if what, anong risk ka? Average risk. Who are the people who are under an average risk? Those who doesn't have history, no family history, no symptoms. All right, no defect in the colon. Average risk, start at 50. Increased risk, start at 40 if you have a family history. High risk if you have the ulcerative colitis, irritable bowel disease, Crohn's disease, start it at the age of 20. If you have a confirmed genetic testing and you are under the highest risk, start it also at the age of 20. All right, so these are for colonoscopy, FOBT, FIT, and then the doctor will going to tell you when you will going to come back for another testing depending on your result. But usually for average risk, which are the 50 years old male clients, they are advised to return every 10 years. All right, every 10 years. Ang tagal, no, bago i-detect ulit, unless siguro magkaroon na ng manifestation or during the 10-year period, meron ng diverticulosis, meron ng polyps, meron ng manifestation, all right? So average risk, start at 50, repeat it after 10 years, or unless advised because of the what? Additional assessment na makikita kay client. Let's go now to the DRE and PSA, which detects your what? Prostate cancer. DRE, digital rectal exam. I-check po ba ang prostate niya? Yes, so the client will assume a what? What position will the client assume? Knee chest position. Ayan, pwede rin yung standing and leaning forward position. And then gloved hands po ba? Dapat po bang naka-gloves? Dapat bang naka-gloves or without gloves? Of course, dapat naka-gloves, no? Alright, so with gloves, hands, and lubrication, ayan, check mo muna ang heart rate ni client kasi baka pagpasok mo, magka-vagus nerve stimulation, vagal yung tibok ng puso niya. This is an emergency, no? Wag nating ano yan, we should not stimulate that. So check first. So pagpasok ng physician, kakapain if it's large or if it's small but hard. If it's large, possible benign prostatic hyperplasia. But if it's small but it is very hard, P size lang but it's very hard, possibly it's prostate cancer. So depende sa makakapa. At 50 years old din ba yan? Yes, we are still on the 50 years old na ladder natin in your slide here. And in PSA, this is a blood test to check for your prostate-specific antigen. Prostate-specific antigen. We will be checking here for the normal result. Please take note, ang normal po natin, 1 to 1.5 nanogram per ml. Ma'am, ang dami naman normal values sa nursing. Ganyan talaga. Maraming normal values, dear nurses. But are they going to ask you what is the normal value? No. They will going to include the value in the situation, and it's yours to know how will you going to interpret that value and what will be the nursing intervention that you're going to choose in line with the value that was presented in the situation. All right? So 1 to 1.5 nanograms per ml, yan ang normal na PSA. Pag tumaas ng 2.5, if the result is 2.5 and up, ayan, you are now a candidate to repeat it every year, annually na. All right, Q year na lang. Ayan, every year. If the result is 2.5 and below, not 2.5 and below, all right, below 2.5, repeat it every 2 years. All right, repeat it every 2 years. Ma'am, ang dami namang kailangang i-memorize dyan. All right, just remember, if the PSA is 2.5, every year ka ng candidate for what? DRE and prostate-specific antigen unless symptoms develop such as decrease in the urine stream, urinary urgency, frequency, hirap na siyang umihi, may retention na, which are signs of what? Enlargement of the prostate. All right, ulitin ko. 15, start TSE. 50, start colonoscopy unless you are on the other risk level. And at 50, start your DRE and PSA. Depende kailan ka babalik, depending on the result of your what? Prostate-specific antigen. All right, pasok tayo dito. Pang babae naman. So let me here. All right. Next, age 20. Sa babae, ang tatandaan mo lang ay line of 2 at line of 4. Alright, sa babae, let me choose the purple color. Right, 20, start your best self-examination. Alright, 21, start your pap smear testing. Na iba. Alright, before at 18, or when you are sexually active. But now, as per the American Cancer Society, 2021, 21 years old na po ang start ng pap testing natin. Alright? And 40 for the mammography. Alright? Or tomo. Okay? So we have 20 years old, start your breast self-examination. Kailan? Every month. Okay? Every month. Gaano kadagal da? Or what's the specific time? 5 to 7 days after menses. Alright. So, kailan daw mag-check for breast self-exam? When you are 20 years old. Ayan. Every month, count ka 5 to 7 days after your menstruation, do your breast self-examination. Ma'am, if the client is already menopause, how can she count for her menses? When the client is already menopause, actually hindi na siya advised sa mga 65 and up. Hindi namin na mammography yung mga ganyan, alright? Pero if in case you still want to check to do the breast self-examination after 65 years old, you can choose a same date every month. Example, 5 nga. Alright? Example, menopause na siya. 65 years old na siya. Alright? Gawin nga every November 5, December 5, January 5, February 5. Pick siya ng specific date to assess. Alright? And when you're doing the breast self-examination, dear nurses, we need to assume 2 positions. We need to assume 2 positions. One is standing in front of the mirror. Another one is lying down with a towel under your back or under the breast. All right? Sa likod mo, maglagay ka ng towel. How many positions again when checking for the breast, when doing the breast self-examination? 2 positions. First position, standing in front of the mirror. Bakit, ma'am? Check for the symmetry. Normal po bang hindi pantay? Normal. Mas malaki talaga ang nasa dominant side. All right? The breast on your dominant side of the body is larger a bit, all right? Slightly larger as compared to the other side, all right? So in front of the mirror, check for the symmetry. Can you also start palpating? Pwede din. Mag-start kang mag-palpate. Or better, assume a lying down position. Okay, towel sa ilalim. And then, pwede kang mag-assess on a circular motion. So if this is the breast, let me just draw here. If this is the client's breast, this is the client's axilla, this is the client's areola, and the client's nipple, you can do your assessment in a circular motion, okay? Start ka, palpate, 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 and at the end, pinch the nipple, check for unusual discharge. Should you also assess here on the upper outer quadrant? Yes, this is very important. Yung area na to, the upper outer quadrant is very important. Why? That's the quadrant that is near to the lymph nodes or to your lymphatic channels na pwedeng pasukan ng cancer or pwedeng area of metastasis. So, pwede siyang entry point, pwede siyang exit point ni cancer, alright? So, assessment, circular motion, pinch the nipple, or pwede ring outer, inner, outer, inner, outer, inner, outer, inner, outer, inner, outer, inner, outer, inner. All right? So that's the second step natin, okay? Pwede siyang circular, pwede siyang outer to inner, and pwede rin siyang, all right, pwede rin siyang up and down. Okay? Up and down like this. Up, down, up, down, up, down, up, down, up. All right, so circular, inner, outer, or up and down. Last portion, pinch the nipple. Very important, again, to assess the upper outer quadrant. Check for your lymph areas kung meron dyang irregularity or immobile lymph nodes or enlargement of the lymph nodes. Check for lumps as well, all right? So every month, 5 to 7 days after menses, standing in front of the mirror, check for the symmetry, go lie down, pillow or towel underneath, and then start to palpate. All right? Better to do starting what age? Again, at 20 years old. Okay? So that's for your breast self-examination. Let's do first mammography. All right? O, PAPS muna tayo, PAPS. Alright. Next, let's go to Pap smear testing at the age of 21. At the age of 21. Meron kasi tayong different tests. We can do Pap test only. We can do HPV only. HPV, human papilloma virus, which is the virus that causes your cervical cancer. Saan mo nakuha yan? Possible, multiple sexual partners. All right, so HPV cause or risk factor is having multiple sexual partner, promiscuity. Masyadong naging malibog, marami siyang naging partner. All right, at 21 years old, you can start your PAP testing only, or you can do your HPV testing only, or you can do combined. All right, so if in case the PAP testing showed the result is normal, all right, so let me just type it here. If in case the PAP test result shows normal, repeat it after 5 years. Alright, kung ang PAP test daw niya ay normal, 5 years nga lang i-repeat. Kung ang HPV niya ay normal, after 3 years nga i-repeat. Alright, ang combined naman, combined meaning PAP test plus the HPV test, if the results are normal, repeat it after 3 years. So, at 21 years old, you are considered sexually active ka man or hindi. Alright? Sexually active or not, but starting at 21 years old, you are advised, you're encouraged to do your PAP testing. If it's normal, be back after 5 years. 5 years. If you are sexually active with multiple sexual partners, you can do your HPV testing. If the result is normal, repeat it after 3 years. Or you can do both. You can do both PAP smear testing and HPV testing. If all the results are normal, be back again after 3 years. Ma'am, what if the result is abnormal? What will be the next step? If the result is abnormal, you will do colposcopy. What is colposcopy? Colpo is the medical term of vagina. Colpo is the medical term of vagina. Colposcopy is visualization of the vagina. Siyempre, hindi yung labas, yung loob. So, magpapasok ng colposcope or the camera inside to check for your vagina, to check for your cervix. All right? If there is what? There is tumor formation, there is dysplasia kung may lump na ba dyan. Okay, so this is basically our ladder as per the CDC and American Cancer Society. Again, let's have a recap. Ano kasi yung age natin at 15 years old? Anong gagawin? Testicular self-exam. At 50 years old, anong gagawin? Colonoscopy or FOBT or FIT, depending on your physician's gusto niya. DNA testing ba tayo? Then we'll do the FIT. All right, at 50 years old as well, we can start your digital rectal exam and prostate-specific antigen. All right, at 20 years old, 5 to 7 days after menses, do your breast self-examination every month. 2 position, standing, check for the symmetry, lying down, palpate, give importance to the upper outer quadrant. All right, pinch the nipple at last to check for discharge. At 21 years old, may option ka. Kung hindi ka naman sexually active, pwedeng pa-PAP test ka lang. Kung sexually active ka, pwedeng pa-HPV test ka lang, or you can do both depending on the result. If you will come back after 5 years, or if you will come back after 3 years, or if you are now a candidate for colposcopy. All right, PAP or HPV or combined. All right. And finally, at 40 years old, di ko pala na-discuss. Ano ba yung kaya? At 40 years old, you can do your mammography or your tomosynthesis. All right. Ma'am, what's the difference? Mammography is 2D testing lang. All right. 2D testing. Is this painful? Yes, it is painful. Why? Your breast will be put in a flat surface and it will be compressed. All right. Example, ito yung breast ni client. Ilalagay siya sa surface dito. All right. And then my clear panel here that will going to compress the breast and will do 2 images. So, isang horizontal image, tapos igaganyan pa yung breast niya, a diagonal image. So, horizontal compression and diagonal compression, which will give you a 2D image of your breast, checking for lumps. All right? And we will not go over to the different types of cancer, the ductal carcinoma, lobular carcinoma, kasi pang doctor board exam yon. Okay? We are not doctors. We are on the assessment, screening, prevention, promotion part because we are nurses. Alright? If ayaw mong pa 2D, alright, which is your mammography, pwede kang pa 3D. Ano yung 3D? Synthesis. Alright? Synthesis. Nung nagtrabaho ako as a virtual nurse, ayan, sa Illinois, ang laging advice is tomo. Ayan, tomo screening. Ayan, because it gives you a 3D dimension of your breast, a clearer image to check for what? To check for lumps which could be cancerous. All right. But aside from all of this type of cancer screening and cancer age screening, still the most important factor that we need to check for cancer is the age. Pangalawa na lang si genetic, pangalawa na lang si family history, si lifestyle, si diet, si activity. Ang tinitignan talaga natin as per the cancer screen, American Cancer Society, is the client's age as the single most important factor to screen for cancer. Why? Because as we age, as we increase in age, there is the increased exposure to carcinogens. All right? So age is our basis. That is why the ladder or the cancer screening ladder was derived. All right, so this is your cancer screening. This is just the next slide is just our image na hindi ko kasi malipat kanina kasi maraming nakasulat sa screen ko, no? Hindi ko ma-erase yung screen. So this is our image to do our breast self-examination, all right? And this is our image to check for our pap smear. We're in tawag dito, this will be done by getting a sample from your cervix using your cotton applicator. Please advise the client, all right, that before pap smear testing, bago po pap smear testing, at least 48 hours, bawal ang sex. Bawal ang douching, bawal ang tampons, bawal ang anything na ilalagay mo sa loob, okay? Alright, kung anumang bagay ang nilalagay niya sa loob, bawal. Bawal ang water. Douching yon, alright? No douching, no sex, no tampons, no jelly, alright? No vaginal spray there because all of this can lead to inflammation. Mamamaga yung part, causing false positive result. All right, mamamaga. Do you want an inflamed result for a pap smear? We do not want that. All right, so that is the end of our cancer screening. Please understand, memorize, put into your memory the caution acronym and our cancer ladder screening. All right, thank you for listening, dear nurses, and let's now move on to our game. Are you ready? All right. Are you ready, dear nurses? Ayan, sa ating Facebook Live, we have 90 plus viewers. And I invite everybody to please join our game. And I think Ma'am Rachel will tell us the prize for the game. All right. And it will be an online game, dear nurses, like the ones that we did last time for the Middle East review, live streaming.
Yes, guys, you will have your prize for today's discussion as well. So last week, we also had our game and we had a GCash prize. So it's the same thing as today that we will have our GCash prize and we'll be giving 500 pesos if ever, whoever will be the lucky winner for this game. So let's get it on, Ms. Haya.
Okay, so I'm going. Please go to your Chrome or Safari or Internet Explorer or whatever browser do you have there in your gadget, in your mobiles or in your laptops, and type in Kahoot.it. Kahoot as in K-A-H-O-O-T. All right, Kahoot.it, and then it will require you a game pin, and you just need to enter this game, pin 199693, whoever will be the winner. This is a 10-item question, true or false, combination of true or false and multiple choice. Whoever will be the winner, whoever will answer the fastest with the correct answer, of course, will have a 500 peso transferred to their GCash account. All right, so we already have 6 players here. We are almost 90 here in Facebook Live. Join na, guys. We have choices. Ayan. And assess nyo rin if you're able to understand the discussion and retain the information from the discussion. Ayan, nandito ulit si Ma'am Misty. Ma'am Misty, good morning. She was the winner last time in our discussion in arterial and venous insufficiency. Right, so we have more players today as compared to last time. Join pa, guys. So we'll give you 2 more minutes to join. Kahoot.it. Type in your game and the game pin area 199693. Ayan, ang game pin po for there who are watching live, ang game pin po is 199693. And it's here in my screen. And in the upper portion of my screen, 199693. All right, 1 minute left so that we can start. All right, ulitin ko, pabilisan ng pagsagot at syempre, patamaan ng sagot. Right, mabilis ka na, tama pa. All right, marami tayong contenders today.
That's exciting to watch, Miss Haya. Ang dami nila. Yes, guys, just join in and let's just have fun.
All right, 30 seconds left. Sa mga hahabol, 199693. Kung nawala kayo, reconnect lang. And I'm going to read aloud the questions kung sakaling naka-mobile kayo at di nyo makita yung screen, all right, while you answer. Okay, for the multiple choice type, you have 1 minute to answer. And for the true or false type, you have 30 seconds to answer. All right, so let's start. Okay, start na tayo. Cancer screening. 3, 2, 1. Question number 1. Skin cancer screening needs checking of the diameter of the lesion. The diameter that signifies increased cancer risk is red, more than 5 millimeter, blue option, more than 6 millimeter, yellow option, 1 to 5 millimeter. Skin cancer screening needs checking of the diameter of the lesion. The diameter that signifies increased cancer risk is red option, more than 5 millimeter, blue option, more than 6 millimeter, or yellow option, 1 to 5 millimeter. 34 answered. I think everybody or...
Sata dito?
Sa habol, ayun ang game pin. Nasa ilalim on the lower right portion of your screen, 199693 sa mga gusto pong humabol.
Miss Haya, meron ba tayong SATA dito?
Wala po. Mahirap gawin sa Kahoot ang SATA. Limited ang characters po. Alright. May mga sumasagot sa online. Join kayo dito, guys, in the Kahoot. Alright. The correct answer is blue. 23 got the correct answer. Let's see. Sino ang 23 at sinong pinakamabilis sa 23? It is AC. Alright. AC got the question correct at siyang pinakamabilis. Next question. True or false? Average risk for colon cancer includes first and second degree relatives with colon CRC. Colon cancer, all right? Average risk for colon cancer includes first and second degree relatives with CRC. Colorectal cancer pala yan. Colorectal cancer. 7 seconds. Average risk ka daw kapag may relative ka. Alright. The correct answer is false. Di ba may ilang risk tayo? 4. Ano yung 4 na risk? Average risk, increased risk, high risk, and highest risk. Kapag average risk ka, wala ka kahit alinmang relative, history, manifestation. Kapag increased risk ka, doon ka may family history. Kapag high risk ka, meron kang ulcerative colitis or Crohn's disease. Highest risk ka kapag meron kang confirmed genetic testing. Alright? Sabi sa question, average risk, so dapat wala kang manifestation. Kaya, wala ka ring history, wala kang family history, kaya false siya. Let's see kung nagbago. Alright, on the lead, still AC. Wow! Next, question number 3. Clients with ulcerative colitis history are considered what? Colorectal cancer risk based on CDC. Pag meron ka daw ulcerative colitis history, you are considered what? Colorectal cancer risk based on Center for Disease Control. You are red, average risk, or blue, increased risk, or yellow, high risk, or green, highest risk. Red for average risk, blue for increased risk, yellow for high risk, and green for highest risk. 25 seconds. Ang gagaling na sumasagot sa ating Facebook Live. Galing-galing guys. Yan. Pero mas mahirap ang actual NCLEX. Di lang natin magawa dito because limited ang characters for Kahoot. Ayan. Gusto ng Kahoot, konti lang ang letters na gagamitin natin. Alright, the correct answer is high risk. Alright, 17 got the correct answer. Congratulations. Let's see kung nagbago. AC still on the lead. Next. True or false? For clients who will be undergoing pap smear, it is recommended to refrain from at least 48 hours from sex and douching. True or false? For clients who will undergo pap smear, it is recommended to refrain from at least 48 hours from sex and douching. Blue for true, red for false. 10 seconds left. All right, let's see. All right, 34 got the correct answer. Very good, guys. Dapat 48 hours, bawal ang anything na ipapasok mo sa loob. Bawal ipasok ang penis, bawal ipasok ang tubig, ang jellies, or anything. So, very good, guys. Let's see, Grace now is on the lead at nag-fire up si Vanessa. Ibig sabihin, humabol siya. All right. Next. If pap smear testing with HPV test will be done and the result yielded normal, the next testing will be after red 1 year, blue 3 years, yellow 5 years, or green 10 years. If a pap smear testing with HPV test will be done and the results yielded normal, the next testing will be after red 1 year. Ayan, blue 3 years, yellow 5 years, or green 10 years. All right, 22 seconds left. Pag sa NCLEX, babalik na rin nila ang situation. Ibibigay nila naman sa'yo ang statement. Sasabihin mo kung alin dyan ang needs further teaching. Ayan. So, dapat alam pa rin natin yung concept na yan. Alright, 3 seconds. 1 and 0. Alright, the correct answer is mali-mali ito. Sorry, guys. 3 years ang tamang sagot. Okay, 3 years, 3 years, 3 years ang tamang sagot. Sabi nga natin, 5, 3, 3, no? 5 years. Hindi naman nag-check si Ma'am Haya. 5 years pag PAP lang, PAP test. 3 years pag HPV lang. 3 years pag combined. Okay? 3 years. Check ko mamaya ha. Sino ang fastest na correct pa. Alright? Sorry. Tamang sagot po ay blue. Alright, check natin. Grace is still on the lead. Check natin kung si Grace pa rin mamaya ang fastest to answer with the correct answer. Meron naman tayong tally sheet and report board later. Alright, question number 6. Metastasis is a way for cancer cells to invade other body parts. Frequently, cancer cells metastasize through, again, metastasis is a way for cancer cells to invade other body parts. Frequently daw, cancer cells metastasize through red, collateral spread, blue, lymphatic spread, yellow, communicating spread, or green, hematogenous spread. Red, collateral spread, blue, lymphatic spread, yellow, communicating spread, or green, hematogenous spread. You still have 23 seconds to answer. Galing namang sumasagot sa live. All right, 5 seconds to answer. All right, and the correct answer is, very good job. All right, 36 got the correct answer. It's lymphatic spread because of the lymph channels, no? Kaya check mo nga lagi ang area na malapit sa lymphatic system. Example sa breast, the upper outer quadrant. Good job. All right, next. Question number 7. The nurse is discussing the predisposing factors of cancer. The nurse explained that the most important determinant is, the nurse is discussing the predisposing factors of cancer. The nurse explains that the most important determinant is red family history, blue lifestyle choices, yellow menopause of hormonal events or hormonal events yun, and green age. Red family history, blue lifestyle choices, yellow menopause or hormonal events, or green age. Yan, this is the single most, all right, important determinant ng factor mo of having, risk factor mo to have the chance na magkakaroon ng cancer. And what is that determinant? All right, what is the correct answer? Correct answer is age. Very good. Because according to American Cancer Society, the more we increase in age, the more we are exposed to what? Carcinogens. Very good job, 25. All right, 25 students got the correct answer. All right. Next, sabi dito, Vanessa has a streak with 7 correct answers in a row. Right, pakita natin sa tally board later kung sino ang ating top 1 pa din. All right. Sorry, PSA ito ha, PSA. PSA, right, is repeated after 2 years if the result yielded less than 2.5 nanograms per ml. PSA is repeated after 2 years if the result yielded less than 2.5 nanograms per ml. Is it a true for blue or red for false? All right, the correct answer is true. Kapag less than 2.5, repeat after 2 years. Pag more than 2.5, repeat after 1 year. All right, annually. So 10 got the correct answer. Congratulations. All right, Grace still on the lead. All right, nag-advance si Kit, si L. Si L, I still remember L last week then. Congrats. Let's go to question number 9. Indigestion, which is usually seen in patients with gastric CA, is due to the presence of the gastric acid. Right, indigestion, which is usually seen in patients with gastric cancer, is due to the presence of the gastric acid. True or false? True for blue, red for false. Ayan, 5 seconds left. All right, very good. False. Is it the presence or it is the absence? Right, the correct answer is absence. Dapat. Kaya false ang tamang sagot. It makes the statement incorrect because of the word presence. It is the absence. All right, let's go to, all right, umakyat si L. All right, next. So, ang magdidetermine mamaya, check natin kung sino si top 1 at kung tama siya doon sa question natin kanina. Alright? Kung mabilis din siya. Next. Last item, number 10. American Cancer Society encourages which correct cancer screening protocol? American Cancer Society encourages which correct cancer screening protocol? Red, breast self-exam when a female has menarche. Blue, pap smear at the age of 30 years old when sexually active. Yellow, mammography at the age of 50 when high risk. Or green, PSA at the age of 50 with digital rectal exam. Red, BSE when the client has menarche. Blue, pap smear at the age of 30 when sexually active. Mammography at the age of 50 when high risk. Or green, PSA at the age of 50 with DRE. 10 seconds remaining. Habol pa ang sasagot. Only have 33 na nagsumasagot. All right. Our correct answer is very good, guys. 50 years old, PSA with DRE. All right. Red is incorrect kasi ang BSE start at 20. Pap smear incorrect because it starts at 21. Mammography is incorrect because it starts at the age of 40. Very good, guys. Let's see. Who's the winner? Oh, pang number 3 pa rin si Grace. It depends on the speed. Pang number 2 si Elle. Sino kaya number 1? 8 out of 10 questions, pero pinakamabilis, AC pa rin. Got the correct answer. All right, congratulations. Ang runner-up natin ay si Whosoever at si Banban. Congratulations. Let me just confirm the kanina kung mabilis si AC, okay? All right. Balik po muna kay Ma'am Rachel. I will just confirm here. Thank you.
Yes, guys, while Miss Haya will still check to it if sino talaga yung nanalo natin. So let me just also thank all our participants who joined our discussion and our game via the Facebook Live. Thank you very much for joining. And on your actual NCLEX, guys, those questions which were presented by Miss Haya are just like pinaka-easy lang yun siya na mga questions. But on your actual NCLEX, you will have like further teaching, you will have select all that applies. So those are like more difficult type of questions. So yung mga questions na like multiple choice, lalo na yung mga basic questions lang, in as much as possible, i-practice natin when we are going to do practice questions. In as much as possible, yung mga difficult questions. But that's what we have shown to you on this discussion, just to jumpstart your energy as well on preparing for your NCLEX. So we just had fun for the exercises that we have provided to you. Of course, guys, you need to have your concept as well on the preparation of your NCLEX, because regardless of whatever kind of question you will be encountering on your NCLEX, when you are well-founded when you have a good foundation on your concepts, definitely hindi kayo mahihirapan sa pag-answer ng question, guys. So make it to a point that you'll be able to master the concept, guys. And of course, you should also be practicing on a more difficult level of questions. So guys, thank you very much for watching this live discussion. Let me present again what we do have in our NCLEX Online Review Program. So you get a lot of more discussions in our actual NCLEX Review Program. We have a lot of concepts which will run for about 3 months, sometimes it's 4 months. So if ever that you will be interested on enrolling for your NCLEX Online Review, then you can communicate with us via our email address at inquiry@ipassprocessing.com, wherein we will be able to provide you the full details about your NCLEX review course. So guys, I would suggest that you really have to master your NCLEX, because I, for one, with regard to my experience, I really had difficulty in passing the NCLEX on my first try. But then I realized that when I really had a good foundation on my NCLEX on my second trial, I was able to make it because, of course, of the good preparation. So regardless of whichever review center you are going to choose, hindi yan siya maging problema. But my point is you really have to go back to your concept, because it's difficult, guys, to answer your NCLEX question just like guessing lang. All of which guess ka lang. So it's difficult to have like that. It's difficult to be in that kind of situation. But when you have mastered your concept, you will be confident, guys, that you will be able to make it. The moment that you're going to go out of the testing center, you will be able to know that I did my best. But when you don't have the right preparation on your NCLEX, the moment that you will get out, and even if you have the right preparation, the moment that you're going to get out of the Pearson testing center, you'll have this kind of feeling na hindi ko talaga alam. What should I feel? Did I make the right decision? Did I make the right decision or hindi ba? Sometimes parang maiiyak ka. Sometimes you really don't know what to feel. I know Miss Haya felt that one as well. But when you have the good foundation, definitely it will be helpful for you very much on being confident na indeed nagawa mo yung dapat mong gawin on your NCLEX examination. So guys, I think okay na si Miss Haya on her final decision.
Final.
So, Miss Haya,
Yes,
sino
ma'am.
yung
Yes, I checked the tally score here. Ayan, share ko ang screen ko again. So, our winner here on the rank 1 there is AC, getting 88 out of 10, and L got 9. However, dun nga sa incorrect natin na item a while ago, and I checked AC's answer there. Correct si AC doon at nakasagot siya at 9.1 seconds. She got the correct answer at 9.1 seconds. So AC still our winner. Congratulations, Ma'am AC, for getting. Yan, wait na lang sa GCash. At in addition sa sinabi ni Ma'am Rachel, dear nurses, totoo yan. When you will be taking your NCLEX, gusto mo ng mas mahirap na questions. Sumagot ka ng mahirap na question, and then another question, mas humirap siya, mag-smile ka. Why? It means pumapasa ka because you are being given a more difficult question because you are able to answer the previous difficult ones. And you can only get the correct answer if you will go back to the concept. All right? Yung study natin sa Kahoot, easy lang yan, but sa NCLEX, babalik ta rin nila. Yung statement na nakita mo sa true or false, yun yung statement na makikita mo in the choices. And you need to know if it's a correct statement or an incorrect one for it to require further teaching or for it to require just documentation. Kaya join na guys sa review. And at least, gumastos ka man ng 70,000+, 80,000+ for your NCLEX application. Gagastos ka lang ng konti for the review and then it will be all worth it. Ilang oras mo lang ba yan pag nasa US ka na, diba? Alright? So, yun po. Thank you very much.
Thank you very much, Ms. Haya. That's really very encouraging. So guys, if ever that you want to enroll, or if ever that you have further inquiries, you can email us at inquiry@ipassprocessing.com. Of course, you can always send us a message via our Facebook page here, where we have our live discussion today. So we hope that you will have a great day today, guys. Kung saan po kayo, I hope that you will be safe as well. And sa mga nagpe-prepare na ng NCLEX nila, ongoing yung preparation, we wish you all the best. Concentrate, guys. You have to really focus on your preparation. And you have to stay motivated and always be focused on whatever the price is. Kasi kailangan natin ipasa ito. It's not just we are getting anywhere yung money natin, but we are investing a lot for this. And this is really for our future. So guys, we wish you all the best. And we're always praying that you will be able to achieve that success that you are aiming for. So God bless for everyone. Bye. Thank you very much for watching. Stay safe po. Bye. Thank you, Miss Haya.
Bye-bye po. Thank you.